Now, one of the things you brought up that I have to talk about, and when we're talking about root causes and dental issues, you were featured in the documentary Root Cause. And funny story of that is Fraser Bailey is a good friend of mine from Australia, and we actually helped him locate that initial cause of what was going on as he searched the world and everything and found out it was from a root canal. But I wanted to ask you, what is the percentage of patients you see that have some dental issues? It doesn't have to be the root canal, but an actual issue that's contributing to their poor health.
At least half.
At least half.
At least half.
And have no clue.
And have no clue.
Right.
And, have not actually had bad, normal dental care. They got the teeth cleaning every 3 to 6 months. They don't have any big cavities that are seen. They don't have dental symptoms. They don't have, a pain in the tooth or something like that. It's all sort of, it's occult. It's underneath the surface. They don't know. And, unless you have some sort of energetic testing, and then you can go to cone beam CT scans. There's technologies to look at this stuff now that you can find it out. But it's real. It's there. And it's at least half the patients I see. And actually, I'm very excited when I see somebody who's been through 14 doctors, and we have a very detailed history and dental history on our intake forms. And I see root canal, I say, I can fix that person. 100%, I can fix that person. If they have breast cancer, I can fix them. If they have chronic Lyme disease, I can fix them. If they have ulcerative colitis or Crohn's disease or rheumatoid arthritis, I can fix them, because that is the most poisonous thing that can happen in a body that isn't ever looked at. If the guy had a big boil on his arm, everybody would be there and they would fix it, but the tooth isn't seen. And the the sort of position that the dental societies take is that these things are all safe and they're fine, and they're not. And it's so, if you know this, you can do it. And I've had biological dentists that think, well, the root canal looks okay to me, but they're not biological dentists. They just don't know what in the heck they're doing. And I've done a very interesting exercise here, because one of the biological dentists that I work with was a little bit leery of the dental association. Because if I refer somebody over there where energetically I'm getting, hey, this tooth is causing you a problem. It's an abscess tooth. And I get the cone beam CT and I see on the cone beam CT, there is an abscess there. You can see it. Like on the 3D, you can see this is an abscess tooth. So one of the things that he does as sort of an insurance policy for himself is that once he pulls the tooth, does a biopsy of the bone at the root of the tooth and sends it for pathology. Because if someone comes back and says, well, this person had a perfectly normal tooth, and why did you pull it? And they had no symptoms. And he says, well, I used to think that way too, but here's the biopsy on the specimen from that tooth at the jawbone where that tooth was. And it shows dead infected bone on the pathology specimen. And here's the culture. And there's 60 bacteria growing in there, none of which should be there. So this was an occult infection. It was an under the radar infection. And now this person, all of a sudden, 1 week, 3 weeks later, their heart arrhythmia is gone, or their fatigue is better. Or I can just look at them and I can look at their face when they come in, because we take pictures of everybody when they come in, of their face. Part of it's so that I can remember who they are, but part of it is they get an actual physical change. The stress comes out of their face. The brightness comes back in their face. And then I know they're getting better. And so that's a big thing. And if more people knew about that and then referred to dentists who know what they're doing, there's, like per the film, there's 25 million root canals done a year in this country. It's $1 billion industry. And when Boyd Haley started doing the research on root canals and the toxins, he wasn't allowed to publish any of his findings in the dental literature. It's all in the chemistry literature. And dentists don't read chemistry literature, and so they're not educated. So, it's nobody knows. relatively with a, there's practices like you guys have and like we have, and there's a smattering of us around the country, but not nearly enough to handle the tens of millions of people who are sick.
Yeah. I mean, we see it all the time, dental foci, all types of issues that show up and that you need to be addressed and are actually at the root cause, you could say, of everything. Now, even when I had Fraser on and we talked about the documentary, it was pulled within 3 weeks on Netflix because of the ADA. Did you get any heat from the ADA because you were prominently featured in?
No, we didn't get anything.
He got a little bit. I mean, listen, he even said, I get it. I understand they're making a living. This is what they were trained in. I don't want to take money out of people's, trying to make a livelihood and everything. I was just trying to show my experience, bring experts on. Netflix gave him no notice. They just pulled it. The ADA wrote a strongly written letter. So I guess they didn't really. Yeah.
He called me and he said, because he originally came here, he called me from Australia. I didn't know who he was. He called me from Australia on a Friday afternoon at 5:00, and it came into the switchboard. And it was a Friday afternoon that I was trying to get out of here on time. And she says, I got this guy on the phone, and he says, you saved his life, and he needs to talk to you. And he's calling from Australia. Do you want to talk to him? So I thought, well, that sounds pretty good. I saved his life. Let me talk to him. So he said he'd had this incident where he'd been punched in the face by this guy in this park. And he got a root canal, and now he was home in bed and he couldn't work and he couldn't do anything. And I had learned all this dental stuff mostly from Thomas Rau, Swiss doctor Thomas Rau. And so I was doing, I made a bunch of YouTube videos on the subject and my experience in people who came in sick. And I told them to get their root canals pulled and they got better. And so he's laying in bed in Australia, can't work. And he sees one of these videos and he says, no one's thought of that. Because he'd been to 14 doctors and he'd been to a faith healer and he'd seen shaman, like he was trying to figure out what was wrong with him. And so he calls me and he says, you saved my life. I heard that and I thought, no one's thought of that. He goes to a dentist, he gets a cone beam, he's got an abscess, it gets pulled, he gets better. And he said, I now want to restart my career as a documentary film producer. And I want to come to the United States and do a documentary. And can I bring my film crew to your office? And so he did. And then, we saw Stuart Nannerini, he saw Mercola, and he saw some other guys. And it's a brilliant film. And it really is true. All that stuff in that film is true. So then we got 300 calls from people who saw the video. It went viral on Netflix. We couldn't even handle the inflow, calling like we saw this and what do we do? And can we come see you? And then he showed me the letter that the American Dental Association, it's all unproven. These are proven safe, blah, 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 blah. So then he put, he's got his website and we refer people there. And it's a great thing.
People need to watch these things because at the end of the day, you need information. You have to have informed consent when you do these things. And this goes across the board. It's not just about dentistry. Medicine's not much different. We do lots of things in medicine that, could be harmful.